Good evening, good evening. Welcome to the first edition of Kidney Disease Education Moment here on Urban Health Outreach Media. I am your host, Steve Belcher. Merry Christmas and happy holidays to you. How's everyone doing? Thanks for joining us this evening. Um, our education moment topic tonight is conservative therapy. The decision is yours. Now, you may be asking, what is conservative therapy? Well, we're going to talk about that. What conservative therapy is a alternative solution if you decide not to go on kidney dialysis. Now, that can happen before the process or it can happen when you start and you decide not to do hemodialysis. So, before I get started, let me get set up here. Go to our page, please. If you're watching, please share this information. Very, very life-saving information. Someone may decide that they may not want to do dialysis, and you know, if they know that they can do that, have that decision to make, then it should be told to them. So, before we get started, okay, I do have to read a disclaimer for the Kidney Disease Education Moment show. This is for educational purposes only. What the user does with the information is not the responsibility of Kidney Disease Education Moment or Urban Kidney Alliance. So, with that said, I'm going to start the Kidney Disease Education Moment, conservative therapy. The decision is yours. So, the decision to do dialysis, excuse me, when one gets diagnosed with dialysis, the decision is a very personal decision. One may not want to do dialysis, one may want to do dialysis. Dialysis and transplant are life-saving treatment options. They may extend life, okay? And I say may because one may accept the treatment to work for them, and one's body may not accept the treatment that works for them. So that's why it's may in there. But they may reduce symptoms of kidney failure. That is dialysis and transplant. They will reduce symptoms of kidney failure. For many people, they may even improve the quality of life. Please, if you're watching, share this information because someone right now, listen, 9 out of 10 people have stage 3 kidney disease and don't even know it. So if that's the case, that means if they don't know it, then more than likely one of those nine, several may move on to full-blown kidney disease. And so if someone gets diagnosed with that, I would, even with myself, I would want to know if I had an option to do dialysis or not to do dialysis based on um, consultation with my family, within myself, and spiritually. So, again, dialysis and transplant may reduce symptoms of kidney failure. For many people, they may even improve the quality of their life. But not all people have the same goals when it comes to treating their illness. Okay. Some people choose not to start dialysis, and you have to respect that. Some people choose to start dialysis and then they stop. Got to respect that. Why would people do that? I mean, why would someone not want to save their life if they were faced with the diagnosis of kidney failure? And then why would someone start dialysis and then want to stop dialysis? Okay? There are many possible reasons. I mean, there are many reasons. You can't fault one for making that type of decision because, again, this is a personal decision. Some people sense the end of the road coming. That can be a reason. They feeling like, hey, I got these different problems going on. Kidney disease, just another one. It looks like things ain't looking right for me. Some people may not see symptoms improving once they start dialysis. They may not see any improvement in their condition. Um, there may be too much pain or suffering for some people. This is real. This is real. The burden of dialysis treatments may be overwhelming. To some people, doing dialysis just may be overwhelming. And there are many people out there that have shared this experience in many of the Facebook dialysis groups that mention being overwhelmed by this disease. There may be spiritual reasons why one may want to stop dialysis uh, after they start or even before they start. There may just be the hope to spend time left with loved ones instead of a dialysis chair. Maybe someone will just say, hey, let me just spend these last days with my family. It is what it is. I'm not going to go through these treatments. I'm not going to go through that process. And I'm just going to let time go on itself. And when it's that time, it's that time. Because really, no one knows when that time is but the man upstairs. Whatever the reason, people have the right to choose treatment. They have the right to choose this treatment. People also have the right to change their mind if the treatment we originally picked no longer fits needs or goals. So you may ask, what is conservative therapy? That's what we've been throwing out there. That is a term. You can look it up. So let's get right to it. Conservative therapy centers around the decision to not do dialysis. This might mean never starting dialysis. This might mean starting dialysis and then choosing to stop. But that's not all. With conservative therapy, your doctors will focus on keeping you comfortable. That's what they do. They keep you comfortable. It's basically called palliative care. They'll use therapies to keep you as healthy as possible during your remaining life. Again, the doctors will use therapies to keep you as healthy as possible during your remaining life. Remember, choosing not to start dialysis does not mean your doctors stop caring for you or about you. Your doctors will work with you and your family to provide you the support you will need during this time because trust me, depending on where you're at and you decide not to do treatment, then some people experience shortness of breath, high potassium, and other uncomfortable treatments when you haven't had treatment for a period of time. So you also got to think about that suffering through that period as well. Okay, what happens if I need dialysis but choose not to receive it? Excuse me. Some of you may have parents, loved ones who may be faced with this decision right now. What if one of your loved ones or even yourself need dialysis but choose not to receive it? Without dialysis, many people will die. That's point blank. The time frame for this could be very different depending on factors. Now, this is depending on how long you live. If you decide not to choose dialysis, depends on many factors. Okay, well, several. One, if you still make urine. If you still make urine, that means that you can excrete or urinate or pee out the toxins. It may not be at a rate that someone with that does not have kidney failure will have, but this will eliminate toxins and it won't be a heavy buildup, but it will be a buildup and the time frame may even take a little longer. Excuse me. All medical conditions. If you got other medical conditions centered around your kidney disease, heart failure, diabetes, excuse me, diabetes, or any other disease that can pretty much speed up that process, then that can play a factor as well. Fluid control and diet. I think that's a big one because if you can't urinate anymore, then you're not able to eliminate the toxins and the fluid. So what that means, if that can't happen, if you can't eliminate these fluids and the poison and the toxins, they're going to build up in your system. And that right there can bring the process sooner than later if you don't be mindful of your dietary and fluid intake. So I believe it depends on the person itself and how long you want to extend your life without dialysis. And if you decide to not choose dialysis and let that process take its course, you can still be mindful and still do what you need to do to be with your loved ones and to still have a quality life during this process that is, respected by all means, because again, this is a personal decision that one makes. Doctors can also prescribe medication and treatments to make you comfortable. Again, that's palliative care. In the end, toxins and fluids will build up. Let's not make any mistake. In the end, toxins and fluids will build up. They'll become too much for your body, and then you'll die, pretty much. Reducing pains and symptoms. If you need dialysis and choose conservative therapy, it's very important to get all the care you need to be as comfortable as possible. Pain management, palliative care, or hospice care may make your symptoms more manageable. Again, pain management, palliative care, or hospice care may make your symptoms more manageable if you choose to do this. Medications may be used to keep your fluid and swelling down, Lasix. If you are in pain or distress, talk to your doctor. Spiritual concerns. People of different faiths may wonder about the impact of choosing to go without treatment. It is usually best to talk to your spiritual leader. If you have a spiritual advisor, leader, pastor, minister, and you decide to take this route, if you have kidney disease or kidney failure, if you decide to choose conservative therapy and the spiritual concerns with this, please, please talk to your spiritual leader or advisor. They will be able to provide insight from your faith perspective on deciding to choose this type of therapy. Choosing to go without dialysis, again, is a very, very personal decision. It's a big and difficult choice. This is not easy for one to make that decision, especially if they got loved ones, because the loved ones are not going to be happy. Okay, they're not going to be happy with that decision, but they should respect it. Talk with your doctors, family, friends, and spiritual leaders if you decide to make this decision. Try to learn as much as possible about your options before choosing this type of therapy. There are many other type of therapies that are safe, that people are living meaningful qualities and safe lives choosing a different therapy that is right for them, whether it's PD, in-center, home dialysis, hemo, or as I said, peritoneal or cycle or nocturnal. Please choose your options wisely. Think about the impact. Okay, again, think about the impact of this decision on your loved ones and your family and friends. Think about that choice. Have the courage to do what you, not anyone else, but what you think is best. Again, talk to your doctor or member of your care team. They can help you learn more about all your treatment options that I just named. In fact, consider having an advanced care plan so your family and doctors know your wishes, which is, in other words, advanced directive. Have that set in place so if something was to happen, whether you have dialysis or not, but if you have a stroke or a heart attack or some other debilitating acute situations that renders you unconscious, and that for God forbid that you're struck with kidney failure and you can't make that decision, have something set in place called a advanced directive. You can get one online at your state website, or you can Google advanced directives for your state. Maybe it could be general across the board, but I believe maybe each state may be different. Again, if you decide to go with conservative therapy, the decision is yours. But please be mindful of that decision. Again, talk to your doctor or member of your care team. They can help you learn more about the other options that are available to you. Consider having advanced care plans so your family and doctors know your wishes. Also, please be mindful and to discuss this with your family, your friends, and your relatives. Remember, it's your life and your choice. Thank you for watching the first episode of Kidney Disease Education Moment. The regular days of this broadcast will be every Friday, 8 p.m. to 8:30 p.m. Eastern Standard Time, USA. Wait a minute. I have someone who commented. Again, this broadcast, Kidney Disease Education Moment, is broadcasted every Friday from 8 to 8:30 or until the education is completed, Eastern Standard Time, USA. Let me see what Ed Michaels have to say. Hey, Ed Mikes, thanks for chiming in. Let me read your comment, brother. I started doing dialysis 21 months ago and no therapy yet. Wow. God bless you, brother. God bless you. Are you doing any therapy if you get any symptoms like shortness of breath or swelling? How is that going along? Are you managing that well? Again, I applaud you for taking charge of your treatment. I don't know what your long-term goals are, but if you're managing it and if you're healthy, you're not having any symptoms, I applaud you. I applaud you, especially if you're being mindful of what you're doing. 21 months, no therapy. Like I said, and like the literature says, and what Brother Leon on Smashing Kidney Disease says, everyone is different with this disease. It may affect you different than it affects someone else. Here, Edward Michaels stopped therapy 21 months ago. And I'm sure that he's doing well. He's not in the hospital. Let me see. He chimed back in. Thanks, brother. He says, hey, Courtney, how you doing, sister? Thanks for tuning in. Happy holiday to you and your son and your mom and your family. God bless you. I was up in D.C. earlier. We're going to link up again. God bless you. God bless you. God bless you. Thanks for coming on, being part of the team. And so Ed says he haven't had any symptoms yet. 21 months, no symptoms. Please share this information. Again, let me reiterate because of Ed's post. This program, Kidney Disease Education Moment, is for educational purposes only. What the user, which is you, does with this information that's being shared is not the responsibility, one, of Steve Belcher, two, Kidney Disease Education Moment, and three, Urban Kidney Alliance, and four, Urban Health Outreach Media. We accept no responsibilities on what you do with this information. However, with that being said, this information that we read is evidence-based information, generalized information that you can Google, but you cannot, I repeat, you cannot dispute human lives experience. You cannot dispute that with this disease because this disease affects everyone completely different. I have seen that not only through our shows, but talking with people or warriors. Let me rephrase that. Talking with warriors who deal with this disease on a daily basis. We have Ed. Ed, where are you from? Could you please post that? But we have Ed that has no symptoms after withdrawing from therapy 21 months. That's almost going on 2 years. Now, Western medicine or the doctors would have you thinking differently, will probably want you to be on there. And that's rightfully so, especially if you're experiencing symptoms, clinical symptoms. I would suggest that too. But we have warriors such as Todd Smith down in Baton Rouge, Baton, I'm sorry, man. Sorry, guys. Baton Rouge, Louisiana. That's my brother down there. He a warrior. He has his own lawn business and he goes dialysis. Sometimes he goes once a month. I've been trying to talk him into going at least once a week. If you don't go, 3 times a week and you urinate, you're washing your labs and you're being mindful. If you're going to reduce your treatments, at least do once a week. I'm not telling you to do that, but I'm saying if you're not going to do treatment, you still have urinary output and some of your symptoms kind of creep up on you, but not as bad, at least do 4 hours once a week. Do something if you're not going to do anything, you know. Ed, where you from? South Carolina. All right, man. All right. I want to try to come through there as well. I've been trying to get down there, Ed. Someone was trying to get me down in the church down there, but it never panned out. So if you know any churches, I don't care if it's African American, white, it doesn't matter religion. This disease affects everyone. The reason why I originally chose churches is because we all know in the African American community, that's where African Americans congregate on Sundays. And that's where the message is being delivered to a mass amount of Blacks that suffer from hypertension and kidney failure and diabetes. However, this disease affects whites as well, but not as a higher rate than it does Blacks. So, with that being said, I'll go anywhere, we'll go anywhere to spread the word of kidney disease awareness, education, prevention, and advocacy. As you've seen, we not only had African Americans on our show, we had whites, we had uh, uh, Simi, he's of Indian descent. There's people from Pakistan, Cameroon. This disease has no name, no race, nothing is labeled to it. It's just that it affects one race more than another because of certain means such as disparity, dietary, hypertension, diabetes. But at the end of the day, it affects us all. So down in South Carolina, it affects our warriors down there a lot because of the diet down in the South. A lot of high sodium diets, and Edward says many dialysis clinics are there. Absolutely. He's not. Oh, Joe Bueno is down in South Carolina. He was on dialysis down there, and they're right. It's a lot of dialysis clinics in South Carolina and North Carolina. I worked at a dialysis clinic in Fayetteville, North Carolina, 50-chair unit. So I seen it for myself, right smack dead in my face. And let me share just a touching moment that I experienced in North Carolina at the Fayetteville Kidney Center. This was in the year 2000, just when the whole 2K phenomenon was coming about. People were worrying about the clocks going to stop, planes falling out the sky, computers crashing. I'm sure y'all can remember that just about 18 years ago, almost 19 years ago coming up. And so, yeah, Courtney, 50 chairs, babe. And up in Massachusetts, don't quote me, but we've been hearing up there where the headquarters for Fresenius North America, Waltham, Massachusetts. Someone told me, and don't quote me, I never seen it, 100-chair unit. If it's not 100-chair, it's a unit that operates 24/7. 24/7. Get that? I mean, people working. You're talking about up New York, Connecticut, that area, Wall Street, fast life, people working. You know, I mean, this is nonstop. And now CVS has gotten into the game and is going to focus on home self-care dialysis. So where you can have a machine where it's going to be dialysis on demand. You could just hook it up to your water sink, into the bathroom, into the kitchen, anywhere, and do your treatment. Had a hose, put the machine in the room, hook up, let's ready to rock. That's what it's getting down to. But we can still get in front of this disease if it's going that way. One, by prevention, and two, if you're already in that disease process of the stage of kidney disease, we can give you information and training that can prepare you for if it's to the point where you can't reverse it or stop the progression. At least you'll be armed with information that will make you or have you mindful of the process. So when you go into that dialysis unit for the first day, you won't be overwhelmed. You won't be hit out of left field. You'll know about the insurance papers. You know what you're getting ready to sign. You know the whole process before it happens. That's what our goal is, to educate pre, to educate during, and to educate after. We got to get it from all angles. Pre-kidney disease, during kidney disease, and then after kidney disease is how we got to tackle this, okay? That's from PSAs, videos, coloring books, t-shirts, okay? T-shirts. Look, I'm non-stop with this. I'm 24/7. This is my mission. Trust me. And after watching Minimalism on Netflix, I'm decluttering everything in my house so I can focus just on this, on making a living to sustain myself, and on a moment's notice, if I need to travel to come to Miami or Louisiana or down to South Carolina where Mike is, or North Carolina where June is, or to Canada where Kim White is, or to Chicago where my sister Monica Fox. There's so many names, Monica, but you are my sister. Or go down to Jacksonville where Karen Hunter Clayton is, or Nashonda Larimore. I mean, that's what I am ready to do. And that's what I'm doing during this holiday. I'm not out there being festive going in. I went to one party, that was a Christmas party, just to show up and get something to eat, because DaVita paying for it. Why not? They pay, I mean, you know, but the point is declutter. That I'm focusing on toxin-free products. You may have seen that lately with me. It's like if it doesn't add value to my life, it's gone. Toxin-free products add value to my life. my skin. I'm 54 years old. When I tell people that, they say, what? You're 54 years old? That's 6 years from 60. I can't even believe it. I don't want to think about it, but God has been good. Those toxin-free products has been good. That's what I've been using. I just been nervous about putting that out there. But my mentors, Stephanie Stevens out of Fredericksburg, Texas, and Lindy Graff have told me to let people know the products that you're using that has you looking as amazing as you look. So, with that being said, I'm decluttering. Only thing I'm having is what I need. No more than 10 pair of clothes, 2 suits, not all these socks, maybe 3 pairs of shoes, and declutter my kitchen, 2, 3, no more than 4 plates, forks. It's just, man, just to declutter what I've done so far feels liberating. It just feels liberating. I can't explain it, but I got a lot of suits that I can't fit that I want to give away, pants, slacks, shirts, shoes, slippers, stuff that I don't even use that's been just in my closet that I haven't even put on. Knick-knack items, gone. All that stuff, gone. I can't take it with me. Why remind myself of the past? Okay? Why remind myself? I just want to be present for the moment, okay? And that moment is here, sharing this information. Uh, anyone else? Thanks, Courtney. Thanks, Mike. I appreciate that. And also incorporate exercise. That definitely helps. But again, you're going to see a lot of hashtag. Remember that hashtag toxin-free products. Let me put that up there. 2019 is going to be toxin free in the urban community or any other community if you want to add to that. And let me also tell you about this campaign. This is a good moment. Please share this. I should make it a separate one. I am going to do a separate broadcast about this, but let me share what's coming up for 219. Steve L. Belcher, RN, MSN, MS Enterprises, and Urban Kidney Alliance is teaming up with Stephanie Stevens, Lindy Graff, and the Modere team at www.modere.com have fabulous toxin-free products. We're teaming up with them. What we got going on is a campaign to donate 100. Okay, this is going to go up as this campaign, takes off each year that we do this, or maybe every quarter. But every quarter, the goal is going to be higher. The first goal is to deliver 100 carefree packages to dialysis patients at a dialysis clinic. Excuse me. Let me tell you what's in these toxin-free care packages. 1, toxin-free toothpaste. 2, toxin-free body wash. 3, toxin-free soap bar, which will be 2. I personally use the soap bar, and they got these little granules in them. So when you wash your body, you can really feel the cleanse. Let me see, that's 3. 4, is the, I believe it's the lotion, body wash. Let me see, toothpaste, body wash, toothpaste, lotion, and the bar soap, and 2 bar soap. All toxin-free products delivered to 100 lucky patients at a dialysis facility. Now, what dialysis facility? We don't know yet. We're going to have a campaign where to have kidney warriors, if they want these packages delivered to their unit, to write and tell us why. We'll come up with the information where to send that information, whether it's a letter or on our page. We'll have a page designated for that where you can write why you think your unit or 100 kidney warriors at your clinic deserve this care package. Toxin free in the urban community. You're going to see that in 219. This is going to be delivered on World Kidney Day, which is Thursday, March the 14th. Some lucky unit. It could be in California, Alaska, Texas, Virginia, Florida, Chicago. We all know that dialysis is everywhere in the United States. Where these 100 toxin-free products are going, we don't know. Right? Let us know if you want them to come to your unit and be a part of this campaign, toxin free. Another campaign that's coming out is the Kidney Kids coloring book. This coloring book is designed for kids up to 8. I tried to, I showed my granddaughter. She's my beta tester, and she just saw a picture of it. But now we got to deal with these electronic and these technology with these smartphones and these other electronic equipment that try to take the place of reading. So that being said, the earliest the better. These coloring books can go to the younger kids, like 3, 4, 5, 6, and then I have other literature and other items to introduce to kids, such as my granddaughter's age 8 and up. So we even have a PowerPoint presentation for kids. So if you have a school or organization that does childhood education, please reach out to us. We do have a presentation specifically aimed at children. We have Captain Kidney. We also have the Kidney Kids. So if you want us there, we're open, we're free, we're available. This is nonstop. So don't hesitate to reach out to us. We do it all, education. We have the equipment to come to you. We have the projector, we have the screen, and we have the information. So with that being said, I'm going to end the broadcast. I thank you for watching tonight. Happy holidays. Tune in tomorrow night. No, I'm sorry. This is Tuesday. I'm thinking it's Wednesday. Tune in this Thursday night. Urban Renal Talk with Tamika and Steve, as we have on the incredible dynamic duo, Bridget and Will Thomas of, don't get me wrong or don't quote me, Conway, Georgia. I hope I said that right, Bridget. Conway, Georgia. They're going to be on this Thursday from 9 p.m. to 10 p.m. Eastern Standard Time. I've known Bridget when she was doing dialysis here in Baltimore County, Maryland. I was the charge nurse at the unit. She was receiving treatment. I had nothing but the utmost respect for her. She respected me as a caregiver. She was nothing but nice to me when I was there. She spoke her mind, and she rightfully had, she rightfully had the, to do that because of some of the mess that she was experiencing there. So I look forward, or we look forward, me and Tamika, having her and her husband on, that she met in Georgia at her dialysis unit. What a blessing. And then to come home to able to do home dialysis, her and her husband, the dynamic duo. We hope their story will encourage other people, whether you're married or not, to take control of your treatment and come home and do dialysis. We're not advocating for that. We're just saying that's another form of treatment for people who are able to do that. Some people are not able to do that. So we have to um, encourage whatever treatment fits the warrior's lifestyle and compatibility. And we will encourage with whatever treatment option one chooses to do, whether it's home hemo, home peritoneal, in-center hemo, in-center health care, conservative therapy, or transplant consideration, whether you don't want to do transplant or you do want to do transplant. We support it all. We respect your decision. Whatever you choose to do, the decision is yours. Thank you for watching another, broadcast, the first broadcast of Kidney Disease Education Moment. We will broadcast every Friday, 8 p.m. to 8:30, or until the message is ended on Urban Health Outreach Media. Until Thursday, when I see you on Urban Renal Talk with Tamika and Steve, God bless you. Enjoy your evening. Peace and blessings. Thanks for watching.